My name is Paloma Beamer. I'm an associate professor of the College of Public Health at the University of Arizona. Did you know that we're made up of the same basic elements as the stars, just in different combinations and forms? Every day, we are surrounded by useful chemicals like the water we drink, the oxygen we breathe, and the food we eat. But chemicals can also combine to make new, unexpected chemicals or concentrate in the environment, reaching high levels where they may affect our health. Understanding the risks that chemicals in the environment have to affecting our health requires knowledge of the following steps. First, we need to know the sources of the pollution, also known as contaminants. Contaminants are chemicals or other substances that are present in the environment that are not expected to be present at all because they are man-made or are present at higher levels than we would expect in nature. For example, trichloroethylene, or TCE, is a man-made chemical. We do not expect to see it at all in nature. Some sources of TCE include past use of degreasing products in the aerospace industry. The next thing we need to know is how these contaminants are transported from their original source throughout the environment. We need to know how much of these contaminants are in our air, water, soil, food, and even our consumer products we use every day. For example, 1,4-dioxane may also be present as a contaminant in about half the cosmetic products sold in the United States. Then we need to know how much of the contaminant we are exposed to in the environment through our day-to-day activities. People are most commonly exposed to contaminants by breathing, eating, or drinking, or through the skin. For example, we need to know which water people are drinking and how much they usually drink or ingest daily. If the water is contaminated with a volatile chemical that goes into the air easily, like TCE, we need to know how often and for how long people are showered so that we may also consider the possibility of exposure through breathing and skin contact. We want to consider and understand all the possible ways people may be exposed to the contaminant. This also depends on the chemical properties of the contaminant. Like 1,4-dioxane, unlike TCE, is not volatile and we would not worry much about it getting into the air. However, in order for a chemical to affect our health, it needs to actually get past our body's natural defenses in our lungs, intestines, or skin. This is what we call dose. I can be exposed to a beautiful piece of chocolate cake, but I won't gain weight from it until I eat it. If I eat more cake, I'm more likely to gain weight. This is what we mean when we say dose makes the poison. It's not that all chemicals are bad. We need them for survival. But every chemical has an amount or a dose where it can begin to hurt our health. All of our bodies are unique, and the same dose of a chemical may affect people differently. Most of us believe that smoking is bad for you, yet we all know those people who live into their late 90s who smoked all their lives. That is because each of us is different and has different characteristics, such as our genes, stress levels, and nutrition, that put us at higher risk to health effects from exposure to contaminants. How do we know so very little to nothing about the thousands of other chemicals we and our children are exposed to every day? Our government enacted the Toxic Substance Control Act, or TSCA, in 1976, which requires the EPA to regulate existing chemicals and the introduction of any new chemicals. After 40 years, why do we know so little? At the time TSCA was enacted, all 62,000 chemicals currently on the market in the U.S. were grandfathered in and allowed to remain in the market without having their toxic impacts assessed. The EPA has only required testing of 200 chemicals in those 40 years. The fact is that we have toxicity data now on less than 1% of all the chemicals permitted for use in consumer products in the U.S. Currently, EPA evaluates chemicals for their safety at a reasonable pace, which is about 10 chemicals per year. The progress for chemicals to be studied for safety and regulated by law is incredibly slow and only protects us from a relatively small number of chemicals. Similarly, we only have technology to measure a fraction of chemicals in our water. Not having a method to test a chemical makes it very hard to test what the toxic effects of that chemical are. So these go hand in hand. This is why 1,4-dioxane was not measured until recently, and we know so little about it. Think of how much technology like cell phones have come since the early 1990s. The same thing has happened to our ability to test chemicals in the water and the environment. With improving technology, we are likely to learn more and more about other chemicals present in our environment and the potential toxic effects. In reality, what is known as the TCE contamination is really a mixture of tens to hundreds of chemicals. We also do not know much about how mixtures of chemicals affect our bodies. Some chemicals are known to work together or synergistically so that lower doses may affect the body if both are present. The mixture we have here in Tucson may not be the same as that present at another TCE contaminated Superfund site somewhere else. Scientists are still trying to come up with ways to study mixtures rather than chemicals one by one. Even though there is so little we do not know, do not despair. There is hope. This is why researchers such as myself have dedicated our lives to trying to understand these tough questions. That is the purpose of research, to look at these huge, complex problems and break them down into bite-sized chunks. Then we try to identify and define a research question related to those smaller bite-sized chunks that we can design a study around to try and answer some of those questions. Ultimately, this is how we hope to add to the knowledge so we can come up with solutions to help protect and improve the lives of future generations and in our communities. So you tell us, what is the next question you have, and how should we work together to answer it?